Hello everybody, welcome back to my channel. Good morning, good afternoon, good evening, wherever you're watching me from. I am Saima. I work for the NHS and my aim is to provide the information for the overseas nurses who are aspiring or wishing to come to the UK, and I want to give them all the updates that we have here and what are the pros and cons. If you have watched my previous videos, you know all about we talk about nursing stuff in the UK. So today video is a bit special. We are going to talk about medication errors and what happens if we make a mistake when you get your PIN, when you are band 5, and if you make any mistake with the medications, what is the procedure you're gonna follow, and then what are the consequences. So without any further delay, let's get into the video. So first of all, I would like to say a big congratulations to all of you who have cleared your Osce or your OET or who are preparing to travel to the UK. I wish you all the best. You're gonna love here. You will enjoy the life here. The life here is so calm, relax. You go to your work, come back home, sleep, eat, and then go back to work again. So if you have a family here, you're gonna enjoy it the more. If you are alone, it may feel like a bit home, work, home, that's it. So it totally up to you. It is totally up to you how you're gonna live your life here in the UK. But trust me guys, the way we live here is more peaceful. I would say, with my experience when I was in Dubai, the life was like very busy. Every time something is going around. Here it's quite relaxed, a bit boring you can say if you want to, but it's totally up to you, your activities, what you do to enjoy, what do you do to entertain yourself. So okay, so we will talk about nursing medication error. When you get your PIN, before getting your PIN, when you are band 3, you don't do drugs, right? You don't do medicines. You are doing the medicines only under supervision, under only the supervision of band 5, band 6 or band 7 nurses. You cannot even give a single paracetamol to somebody. But when you get your PIN, they can all your senior nurses, your band 6, band 7, or your manager, she can sign your competency form, or for the oral medication. First of all, they do it for the oral medication, and then they also check your competency level for the IV drugs and for cannulation and all those things. So those ones will be signed off accordingly with the time. Those of you who doesn't know what is supernumerary period, supernumerary period is the period when you join a new job. Let's say if you are band 3, you join the trust, you work under someone's supervision for certain time, for 2 weeks or 3 weeks. So you work under someone's supervision for 2 weeks or 3 weeks, and when you get your PIN also, you're gonna work under someone's supervision, under band 5 supervision, for 2 weeks or 3 weeks. So what happened, they moved her, she was a band 5 nurse, she was doing all the things, and she's been in the trust for 2 years, so she knows what she was doing. But this mistake happened, and then her manager put her back in the supernumerary period. And you know, it feels disheartening, it feels really bad if something happens like that. You are removed from your post and then you're gonna work under someone's supervision with your colleague. It feels demotivated, but of course we learn from our mistakes, isn't it? Instead of taking it in a negative way, you always learn from your mistakes. So anyways, she had to work under someone's supervision for 14 days, and she couldn't do her drugs, she couldn't do anything, you know, all the procedure. They cannot do drugs, and because she will be under supervision, so someone needs to be there to watch her what she's doing. You know that feeling. It's horrible. So it's a bad experience, but guys, you need to learn from it. If someone makes a mistake, we need to learn from it. And then always there is a revalidation process. There is a what do you call it, when you think about it and write about it, self reflection, you need to make a reflection, isn't it? So there, you need to write a long paper, what happens, and what you're gonna do in the future, how you're going to improve it, and how you're gonna prevent it in the future. There are lots of things, and then you will go and see your manager, you will go and see your in charge, talk to them. It's a bad experience. So it's better to avoid the mistakes, isn't it? Always check the stat dose. If stat dose was given, always check the timing of the medication, always check when it was given, what time it was given, am I giving at the right time. If medicine is due for within 4 hours or after 4 hours, if 4 hours complete now, if it's due after 6 hours, is 6 hours complete now, right? Just check and check the timing, always check the timing. And then also the allergic status, if someone is allergic to that particular medication. You know where I come from, if we give any antibiotic, we always give a stat dose. So if it's a simple medication, not controlled medication, you're gonna do you're gonna inform your nurse in charge, your doctor, and do a datex. Datex is a safety learning event, like you learn from it, but you need to report it, whether it's a fall, it's a trip, or trip, fall, or any minor mistake, or a near miss. If a patient was going to fall and then you saved him or something, everything, a tear, or moisture damage, or a pressure damage, or pressure ulcer category 1 or 2, or whether it's increased, the category is increased, so you need to datex it. Datex means you need to report it, that this event has happened, this is my first time that I have seen it, and then this patient didn't have it before. You can go through the patient notes and check if it's the first time you noticed it, or he had it before. Then you report it online, right? And if it's this is the datex procedure. If something happens, harm, no harm, or near miss, or severe harm, all those things you need to remember, and you need to mention it in the datex is very important. I'm sure it's all over in the NHS, but I'm sharing with my experience in my trust. We do datex. We report if anything happens with the patient, or with the skin, or with the medication. If I made a mistake, or someone else made a mistake, if you observe anybody making a mistake, you're still going to datex it. You're going to report it to your manager. It's your responsibility. And then also, if fall happen, you're going to inform the next of kin as well, and tell them that this has happened. If there is injury, tell them. If there is no injury, tell them as well, and what you're gonna do about it, right? So this was a follow. We got off the topic, isn't it? Right. So medication error we were talking about. If it's a normal medication, I told you the procedure already. But if it's a controlled medication, so what happened with my friend? She made a mistake with the controlled medication. Let's say, I'm not sure which medication, but let's say morphine. So she made a mistake. She gave the patient very high dose. So right, the controlled medication, it's always given with 2 persons. 2 nurses need to sign it off, and then 2 nurses need to go and give the medication to the patient, not only 1 person. 2 person, 1 person is a witness, the second, you are the one going to give it, and there should be a second person witnessing you giving it and taking it off from the controlled medication cabinet. Yeah. So what happened? She gave the very higher dose, because maybe she was saying that they misread the name of the medication. So if you're not sure about any medication name, ask the other person, can you read this? Don't tell them, I think it's Oromov. Don't say that. Ask them, can you please read it for me? Okay. So because if you're telling the other person, I feel like it's Oromov, the other person may think, okay, maybe she thinks it's Oromov, maybe it's Oromov. No, tell the other person, can you please read it for me? And then if they say, okay, this one. And if you're not sure, even with 2 people, check with somebody else. Check with your nurse in charge, or check with the doctor. If the doctor is there, check with the doctor, what is that name of the medication, without making any mistake. It's always good to double check, because if you're giving wrong medication, it can harm the patient. But if you don't give them, it will not harm that much. right? If patient is suffering from pain, they may feel pain a little bit like for longer, or maybe 10-15 minutes more when you're checking. But if you're giving wrong medicines, it can give them very bad side effects, isn't it? So what happens, they misread the name of the medication, and then both of them, they give that medication, and luckily nothing happened to the patient, but it was reported to their manager, to their nurse in charge, and to the doctors. They did fix it as well. But what happened, their manager, she put her back to a supernumerary period. First of all, you will be signed off for the oral medications, so you can do the oral medication. But with band 3, you are still under supervision. When you get your pin, you will be signed off for the oral medication first of all, then the IV, and then all those rest of the things. And where you are signed off, you can do them alone. Before that, you're gonna do it under supervision. And now, what are the important things that we need to remember when we give medications? We need to check the patient ID verbally with your notes, and then if your medication prescription is on the computer, if it's online, you're gonna check with the patient, ask the patient their full name, date of birth, and if they're wearing ID band, you need to check the hospital number as well, because most of the time what happens is most of the patients, they have similar surnames, so it just makes you confused. So don't get confused. Ask the patient full name, their date of birth, and then check the hospital number with their ID band before you give any medications. That's the very, very important bit. The second thing we're gonna mention here is about the 6 rights of the medication. You know, right? The correct medication, right time, right dose. If doctor has signed the prescription, when this medicine should we give? Like, what is the start date of medication? And then if the patient is allergic to, most importantly, the allergic status of the patient. What kind of reaction do they get from it? So you need to remember, keep in mind these all things. But sometimes if you get 10 patients and you make any error with the medication, what will happen? So it depends what kind of medication you're making error with. Yeah, so if you give simple like a paracetamol and you gave overdose, or you didn't follow the time when the last dose was given, what will happen? You need to inform your nurse in charge right away that I made this error. You will inform your doctor right away that this has happened. I didn't check this date, the previous time of the medication, if stat dose was given. So you need to check when it was given. And suppose you made a mistake already, you need to inform your nurse in charge right away, your doctor right away. And what is their plan according to the doctors, or according to the nurse in charge? What's the plan? You're gonna follow the procedure right away. You're gonna do the observations for the patient, ask them if they're feeling anything different, if they're having any different sign or symptoms, or if they've experienced any other problem. Yeah, so keep an eye. And I'll share one experience of one of my friend. She doesn't work in our department, but she works somewhere else. But you know, she's my friend, so she shared her experience. I would like to mention that one. She always used to give a stat dose, but here maybe because they check the allergic status of the patient, so they don't need to give a stat dose. They don't usually give stat dose here. So if somebody is prescribed Comox, they give right away. And that's why when you give any antibiotic for the first time, keep an eye on the patient, check for their observations, keep an eye, ask them if they're having any problem, if they're having any allergic reaction or anything, even though the allergic status is mentioned. So that's it, guys. I was feeling really bad, and then I thought, okay, I'll share it with my friends and colleagues, because when we come from a different place, we don't know these things. And CDs and controlled medication, we are doing loads of CDs here, so just keep in mind, loads of controlled medications we need to give. And then it's always best, always, for all the medication, whether it's a CD or normal medication, check the timing, check with someone else if you're not sure. And there will be no penalty if you are missing the dose, or if you are not giving the medication because you think it's a wrong dose or wrong name of the medication that I cannot read, if it's not legible or valid. There will be no harm if you don't give the medication, but there will be harm, of course, if you give the wrong medication. Okay, so as I said, right, there will be no harm. Yeah, there will be no harm if you don't give that medication, but there will be harm if you give a wrong medication. So just keep in mind, guys, you are responsible for what you do. You need to be assertive, you need to be responsible for your things, what you do. You can lose your pin very easily if you're making any medicines mistakes, because if one mistake, two mistakes, your manager may like ask you to write a self reflection, and then that's it. Or they may they may remove you from your band and then put you as supernumerary for some time, that you need supervision. It's not a good experience, guys. So make it a practice when you come here. Make it a practice that you need to do the drugs according to the right dose, all the rights of the medication, and then always check if PRN medication was given, if stat dose was given, and whether the patient is allergic to it or not. So that's it, guys, for today. I hope you liked this video. If you did, please share it with your friends, give it a big thumbs, and subscribe my channel. It will help me in a long way. It means a lot to me. It motivates me to make more videos. So I'll see you soon in the next video. Keep watching. Take care. Bye bye.